Hi, my name is Chelsea Sexton. Today I'm going to present my matrix for bedside handoff and how it relates to patient safety and reducing falls for hospitalized patients. The objectives for this presentation, I'm going to introduce my PCOT question, the importance of this topic, gaps in literature, and personal values, as well as the outcomes. According to Lee Lauren and Shore, in the United States, there's over 1 million falls that occur in hospitalized patients with the potential to lead to injury. The Centers of Medicare and Medicaid Services, they've kind of pushed back on hospitals by taking away reimbursement as falls are thought to be preventable. My peacock question for hospitalized patients: how does the nurse's bedside shift report influence patient safety in comparison to non-bedside shift report for the duration of the patient's hospital stay? This slide is an article overview. In Article 1, it is a retrospective study design of a large Italian hospital that collected data from incident reports. It gathered this information to identify in what times, either during handoff or non-handoff times, that these incidents happened. In Article 2, it's a quasi-experimental study design using pre-test and post-test surveys, observations, to evaluate bedside report using SBAR and patient safety surveys. In Article 3, it uses the quasi-experimental study design to evaluate the quality of care using the Quality Patient Care Scale and SBAR before and after receiving the SBAR education. Article overview continued. In Article 4, this is a non-experimental study based on observations to identify nursing tasks and its relationship to falls. This research is significant because it shows a relationship between the nurse's time spent and behaviors, hourly rounding, and bedside report that can identify areas for improvement in fall prevention. In Article 5, this is a quantitative research study using a semi-experimental design as the nurse participating are tested on the baseline knowledge of their SBAR report method, and then they participate in education as the intervention. So they do a 3-day training with posters and banners on the SBAR method and shift handover. Once those trainings are completed, the nurse completes an SBAR checklist and the patient safety questionnaire, which shows how the SBAR has impacted the safety scores. Significant findings. In Article 1, according to Damari and colleagues, out of the 1,966 falls, 88.6% occurred during non-handoff times. 73.9% of falls occurred during weekdays that were not during the nurse handoff times. 73.6% when compared to the times during handoff, where 48.3% occurred at nighttime. Whereas on the weekends, 28.3% of the falls occurred more during handoff, given an impression that staffing ratios and support staff might be more significant area to research in relation to falls. In Article 2, according to Campbell and his colleagues, the question asks experience of poor outcomes related to shift handoff has showed improvements when the pretest response for disagree was at 43%, and the post-intervention test was at 84%. The use of SBAR at the bedside has improved patient safety outcomes. The survey question, asking the patient's perception of a complete and accurate handoff report, that went from 43% of nurses who agreed to 77%. Results found that both scores on the AHRQ patient safety survey had improved from 2015 to 2016, showing a horizontal data line on the culture of safety score. In Article 3, there was an increase in the ANCOVE scores on the QualPACs after intervention with the SBAR. That was shown to be statistically significant. And included in the slide is the mean score results. Significant findings continued. Sons and colleagues found that there was significant finding with falls occurring more on night shift, and also that these occurrences happen more on Mondays. The study also found that frequently hourly rounding may not contribute to the reduction of falls independently, and that additional patient information would be beneficial for future research. Reviewing these results, I do see similarities with Article 1. Article 5, the sample t-test results show statistical significance, showing that the SBAR scores were higher after intervention, as well as the scores mean increased using the Wilcox test. The research shows that there is significant improvement after intervention of both SBAR scores and patient safety scores. These findings support that the SBAR improves handoff communication and improves patient safety outcomes. Literature gaps. In reviewing the literature, there is limited information on bedside handoff versus non-bedside handoff. The research seems to focus on SBAR handoff in the literature review. There is limited information exploring environmental factors, distractions, or demographics of patients who fall in the hospital setting. And how is practice affected by these gaps? Currently in nursing, there is a raw belief that many patients fall during shift handoff, when the issue could be problems with staffing. There are gaps in the research that doesn't address the environmental factors, such as noise and patient volumes during the daytime. These gaps could identify areas of concern where practice could change, or practice changes could be adopted. Implications for research, recommendations for future research. So for future research, it could be beneficial to focus on staffing and hospital resources to improve patient safety and prevent falls. Further research could also explore bedside hourly rounding and its relationship to falls. What changes could be made that would improve the issue? Utilizing SBAR seemed to be significant throughout the research, improving staffing ratios, improving education for patients, and also for staff. This is a list of my references and concludes my presentation. Thank you.